the SPSM Chat 2.0 reboot. We like that. I like that name. I like that. April Foreman and I used to talk about it being like a TV show that had a reboot,
Yeah.
further along on the side. And I am thrilled to be able to tell you tonight that we have a very special guest. And Jonathan, introduce yourself. I don't need to do that for you.
Sure. Yeah. Hi, Jonathan Singer. I am an associate professor of social work at Loyola University Chicago. In April, I will step in as president-elect of the American Association of Suicidology. Thank you. I'm the founder and host of the Social Work Podcast. I'm the co-author of Suicide in Schools, Practitioner's Guide, and I'm the co-lead of the Social Work Grand Challenge, Harness Technology for Social Good, and I am the treasurer of the International Association, Human Services and Internet Technology Association, which has been around for about 30 years, looking at the intersection of human services and technology.
That
And
is a mouthful.
I know Husita is the name of that, but
Okay.
but it's an honor and a pleasure to be back here. So thank you, Anne Marie, for the invitation for tonight.
Oh, you're welcome. And for everybody out there, I just want a little housekeeping because we didn't, okay, Tracy's sleeping, so I can't blame her. I did not get a lot of the usual pre-event reminders and chat, so I'll go through that little housekeeping now. That if you can remember, please, and I used to forget all the time, if you can use the hashtag SPSM when you're tweeting or retweeting or quoting someone, replying to someone, that would really be helpful for when we get to do the curation with the Wakelet afterwards, so that we can follow. I am doing my best to follow you on another computer at the same time. It's a bit of a challenge, but sometimes I think I can walk and chew gum, but I'm not really sure about that anymore. Not the older I get. So that's one thing. You're not going to see a whole lot of the questions going through that you usually do. So we're just going to roll with this tonight. And hopefully some of you who are out there, some of the regulars, if you could please repeat some of the comments or questions you hear that Jonathan and I are going to be talking about. This is a follow-up, more or less, to last week's show, which was suicide, grief, post-traumatic stress, a public health approach. Tonight, we're going to narrow that down to schools and technology in schools. And Jonathan's going to do most of that. All of that.
Oh my God.
But I wanted to start with kind of setting a tone because it's been so predominant in what I've been doing now for the better part of we started in January. So a quick backstory, keeping an eye on the time. One of the hats I wear here in Massachusetts, I do consulting work for the Department of Public Health here in Massachusetts for suicide prevention. And part of that is, though, I also oversee one of our 10 regional suicide prevention coalitions. We're very blessed in Massachusetts to have that solid of a structure, that we have 10 regional suicide prevention coalitions across the state. And we're pretty autonomous and independent. We're not cookie cutter by any stretch of the imagination, but everybody does their best and does a whole lot of good work. Within my region, it actually is a secure county. So that's 500,000 people, 20 cities and towns. That's a lot of schools. That's a lot of police. That's a lot of people. We also happen to have, unfortunately, in spite of all of our work for the last 12 years, a lot of trainings and education and public information events across the lifespan. We still have among one of the highest suicide rates in the state. In 2018, we lost 86 people across the lifespan. 3 of those were young people, a 14-year-old, an 18-year-old, and a 19-year-old. And so among the things that I get to do is, because I started this journey as a trainer 30 years ago in public health with domestic violence and substance abuse. And then 12 years ago, DPH asked me if I would step in and do some work in suicide because we had a high incidence of adolescent and teen attempts that were going on here. And the Garrett Lee Smith grant came into play. We decided, our coalition decided, our Bristol County Coalition decided that we were going to hit the ground running. We were frustrated, frankly, because we were doing so much work and our numbers kept going up, which is a national issue. It's not just ours. And we decided we would hold these town hall meetings. And so we held one in January, February, and March, and we'll be having another one in May. And what we're doing is opening up the conversation. We have an attempt survivors share their lived experience, loss survivors share. I talk about being an impacted family member. We have resource tables. We have young people that we know have great safe messaging, and they come in and share about teen depression and different things. And as that process happened, school districts came out of the woodworks. It isn't that I've never done any work with these particular school districts, but they started to come out of the woodwork. And so I'm running as fast as I can, really, because they wanted all their faculty trained now. They wanted them trained before the end of the school year. They did not want them to go out this summer without being trained. I don't have a problem with that. It's a time issue. Do we have other trainers? Of course we do. The problem is they are all volunteers, so they're only available in evenings and weekends, and that doesn't work well for schools. So I've been training the schools, and this is where Jonathan really comes into play, because I kept thinking of him as I'm standing in one school district after another, and we're doing it building by building. So it's elementary, middle school, and high school. We're dealing on the staff right now, and then we will be doing some work with the students. And the questions that will come up are about trauma, about post-traumatic stress, about really how young should we be talking to students about being excessively sad or depressed, or talking about suicide. We have had losses, therefore we have kids that are traumatized. Big issue comes up is ACEs, Jonathan, that's the undercurrent. And I'm so happy to say that these 3 school districts in particular that I'm working with right now have all begun to, they're working on implementing curriculum for SEL, for the social emotional learning, from pre-K right into kindergarten, right into elementary school, right up. I think they're all looking at it to about grades 5 at this point. I know there are also social emotional learning issues within all the middle schools too. Those are skills that a lot of our kids don't have. So we see grief, we see trauma. We've had a suicide within one school district. They now have, by the way, I'm not happy with the name, and I did suggest that they change it. They now have formed a mental health club in one of the high schools, and they also have a variation of it in the middle school. I gently suggested that they might want to change that name, because while kids can be brilliant about stuff, they can also be mean, and tease and bully. You know, if you're going to Spanish club, you always get that look in your face if you say, "Oh, I'm going to Latin club after school." You know, that would be me. 6 years of Latin. Or I'm going to the French club. Even the kids who still go to what used to be called the Gay Straight Alliance, and they now have very different names, will still get bullied and harassed straight out, because it's a little different. And so I was concerned about them using that terminology, that might keep kids away who really could benefit from having that peer-to-peer type of setting. So I'm working in schools. They're constantly asking me about trauma. They're asking me about what to do. They want to do long-term strategy planning, Jonathan, as to what would that look like. So that's what I'm doing, feet on the street. That's what I've been doing for the last month. I mean, I've been doing it for 12 years, but with juggling these 3 school districts, doing a podcast with one of the superintendents tomorrow morning. And he said, "So what should I call this?" And we said, "Suicide." He said, "Did you want me to call it something else?" No. We said suicide awareness and education, because I'm trying to pull back on that word prevention a bit, and focus more on emotional well-being and the quality of life, particularly after postvention. You know, once we've gone into the schools, these 3 schools, by the way, one of those school districts in January lost an 11-year-old. So that has had a profound impact on the faculty and on the students. Yeah. So that's what I've been doing for the last few weeks, Jonathan.
Oh my God, so much.
That has nothing to do with my rest of my job or anything. I mean, I'm thrilled. I don't want that to sound like a complaint. It's exhausting, but you know what? Every time I walk out of one of these classrooms, you can see the light bulbs going on with the teachers. You
Yeah.
can see the intensity of listening and care.
Mhm.
And that is so nice to see. They want to know what to do next. And I wish I could tell you that I had enough funds in my coalition at this time to be able to say, and we dropped off your books everywhere. I need to find some grants for that, Jonathan. I love the book. I love the
Thank
book.
you.
All
Thank you.
right.
Thank you.
I find it so much better than anything I've ever suggested to schools.
Oh, wow.
And
Wow.
no, I mean that. I mean that. I mean, I took the old materials and I took this and I said, yeah, okay, there's no contest here. Well,
Amazing.
because you've taken a more modern approach. Remember, some of the stuff that we've had to use, even off the best practice, the old best practices are very old.
Yeah.
They don't take into consideration the depth of social media,
Mhm.
and the other pieces that are on. So, Tag, you're it.
Well,
Go.
wow. I mean, I'm exhausted just hearing all of the things that you're doing in your off hours. And
Yeah.
so, but so grateful that you are putting in the time and that you're giving these school staff the aha moments and the hope, because we know that at a very fundamental level, building lives worth living is all about hope. It's
Yep.
all about saying, for the individual who might be thinking nobody will care if I'm around, it is about saying, yes, we do care. We care deeply.
We do.
And more importantly than what we care about, we want you to want to be here. And for the school staff and for the teachers and the administrators, and of course the school mental health professionals, we want them to have the sense of hope, to have the options in their minds for what is possible, so that when they are talking to people who don't have the hope, that they can hold the hope for them. And so they can say, no, 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 I know it seems hopeless right now. And even if you are not in a place where you can advocate for yourself, even if you're not at a place where you think that your life is worth fighting for, I do. And I'm hopeful about that. And so when I hear you talking about your work, I'm imagining these school staff getting a piece of that. And that's wonderful. And especially in the wake of a suicide, especially when a community is grieving and there's so many things happening. And worst case scenarios, you have schools that are afraid of a lawsuit.
Oh God, yeah.
So there's of course the sense of, on one hand, you have schools that desperately want to provide the support for the families. And these same schools, if they're afraid of a lawsuit, have legal departments that are saying, okay, now hold on a second here. Let's be very intentional and perhaps cautious about things, which after a death can come across as unresponsive and insensitive. And so it can set up a tension between a grieving community and the place that had the most contact with this kid that everybody loved and has now lost. And that is a tragic situation.
We have hopefully avoided that. It helped, I think, because we have here in the city, well, not just here in Taunton, but we have 4 kitchen table conversations, we call them. So I'm a certified grief I'm a loss survivor. It's
Mm-hmm.
not something I usually dabble with, but um, so we were able to, thankfully, be able to wrap our I brought in several people from our other kitchen tables all into our house here, and we were able to spend a whole day with the family. And I know that made a difference. I am so um, I so admire Frank Campbell's work with the lost teams. We have one here in Massachusetts right now.
Mm-hmm.
And it took 3 years to get that one up and running. I would love to see one come down here in my spare time.
Mm-hmm.
But being able to, that is so important, to be able to talk with the family as soon as possible,
Yeah.
to help them work through those emotions. And yes, there was clearly some ill feeling, and there's anger, and that's
Yeah.
understandable and natural.
Mhm.
And we reassured the family. You would have appreciated seeing Tracy working with 6 of the 8 siblings that were left behind.
Mm.
Really, I mean, she did an amazing job. They were playing musical chairs.
Mm.
The one of the young girls crawled up on her lap and wanted to sit and talk with her about it. And she was so wonderful about being able to understand how they were feeling. You know, as a
Wow.
suicide attempt survivor, she brought a gift to the table to be able to do that. But I have to say that the school district has become unbelievably proactive. If
Mm.
they were guided by any caution, they ignored it. They've just gone full tilt. They said, the first time I met with one of the school districts, they said, you have an open book here. What is it we can do? You tell us what we need to do.
Mm-hmm.
So then I'm going to throw it back to you, because they are also looking for, and that's where I certainly need some help. And I turned to your book for that.
Oh, that's
um,
great.
by the way, guys, I'm not getting any royalties. Don't worry about it. Um,
I
and,
barely get any, so yeah.
oh, I know the feeling. Believe me, I know the feeling. Yeah, everybody thinks this author thing is really great. No, don't hang your hat on that one. But it's the long-term strategy,
Mm-hmm.
to keep changing it up, to keep diving deeper. So we do the
Yeah.
original gatekeeper trainings, and then maybe we get them to a mental health first aid,
Mm-hmm.
or some of them to an assist. But you can only take a few staff out to do that. You can't take the whole school out to do that.
Right.
And so where is the long-term strategy? Because it's not all, I say it again, it's not all about prevention. It's not all about that. Education is the Narcan for suicide prevention. It's
Mm-hmm.
the education in the community. And Jonathan, the hardest group we have to get to the table are the parents. Your turn.
Mm-hmm.
Hmm. So I wish we knew how to get the parents to the table.
Yeah. It's such a tough call, and I would have loved to have seen Tracy in action. That sounds amazing.
Oh,
And
yep. We should have filmed it.
and I think that this is one of the pieces that is really important for schools to remember, and for community members to remember, which is, effective suicide prevention isn't one program, right? It is a whole series of efforts, starting with what we think of as prevention,
Mm-hmm.
which involves everything from the actual programs to provide education and awareness about specifically for suicide prevention, like, risk factors and warning signs, but also a lot of the associated things about depression and anxiety and impulsivity, and the importance of social emotional learning and peer groups and things like that. There's the piece of gatekeeper training, which is, when you see something, how do you say something? And then
Right.
how do you make a referral? Because you can't make a referral if you don't know what's out there, right? And
Yep.
sometimes there isn't much out there. And so
There isn't.
it really takes school staff time and energy to identify providers in the community that have training in working with kids who are at risk for suicide. um, who are struggling with some of the issues associated with suicide risk. And, so I'll just say, if anybody is, if you are watching this and you're saying, well, yes, I have this training. It's been a passion of mine. I'm not connected with the American Association of Suicidology, or, I haven't gone on an overnight walk for AFSP, and, I haven't joined one of the statewide coalitions, but I have training in suicide risk assessment. I've worked with several clients. I feel passionate about this. Like, contact your local school and say, this might seem out of the blue, but I'm somebody you can refer to, right?
That is so important. Oh no, I'm serious.
Yeah.
And you know what? I've actually, it's odd, ironic, whatever, because I am now starting to get calls from clinicians who, because with the work that we did from January up till now, we also had an amazing amount of media coverage, Jonathan. I mean, all good stories, all talking about, what we were doing and why we were doing it. And I started to get not inundated, that would be nice, but I started to get a couple here and another one there and another one there, one from out of state, even saying, we should. What did she say? She said we should be doing something about letting people know that we are available. And the whole thing turns on, unfortunately. And here's one of the stories we heard at our town hall meeting a couple of weeks ago. A mom got in and she had kids that, one child in particular, she knew needed help, behavioral help, and just couldn't get a diagnosis, couldn't do a bunch of other things, and ended up on what for us here in Massachusetts is Mass Health. So the Medicare, the Medicaid, and all of that, and the Mass Health finally got him everything he needed. Got a good diagnosis, got appropriate medication, had a good relationship with his counselor, and yet the school district at that time, different school district, not one I'm working with, would not even entertain the need for an IEP. Now, this is someone who has major behavioral health issues, but she was at least able, finally got it. It took 2 years. That's 2 years too many for me.
That's a long time in a kid's life. 2 years.
No kidding.
Oh my goodness.
No kidding. When you're talking an adolescent.
Oh.
But then what happens was that now she's getting him taken care of for 3 years. They bump up their income, they bump up their job, and they end up in private insurance, and now they no longer have those services available because here locally, it's almost stay low income, because then you can get better services than if you have sufficient income to have really good private insurance. And that's the catch-22 we're in here. So I don't mean to take that side trip, but that plays into the stress and the trauma on the families.
No, it really does. And I think this is another important piece. And one of the problems with our mental health system is that there is what we in the research world call a bimodal distribution, which is that you get people who are on public insurance, right? Some form of Medicaid, typically for kids, Medicaid, typically not Medicare, but Medicaid, getting more services than people who are in the middle incomes. Who maybe have private insurance, but can't afford the $50, $75 copay.
Right.
And that middle group certainly gets far fewer services than the wealthy group that can pay out of pocket or can pay the $75 copay. Or even if it's a $25 copay, that's just, chump change for them. So there is this bimodal distribution. So I'm so glad that you're getting people who are contacting you and saying, hey, I'm a resource. Because honestly, like, you don't know. I mean, if I'm a school counselor if I'm a school social worker, first of all, I don't have the time to sit there and go through a phone
No,
book or whatever today's modern equivalent of the phone book is, like the
I don't know what
Psychology
that
Today
is.
website or
Yeah,
goodtherapy.org, right? And like, search by zip code and then try and figure out based on these profiles who is adequately trained and appropriate for working with suicidal kids, because it's not something that any of these listing services have as a default category, right?
no,
You see these therapists on Psychology Today and goodtherapy.org, and they say, I work with and then they work with basically everybody in every modality. It's so funny to see so many therapists that are like, I'm trained in DBT, CBT,
yep,
psychodynamic, solution focused, and I work with couples, faith communities, LGBTQ, blah blah blah, and you're like, really, you have expertise in all of this? As a as as a as
I
a
wasn't
social work
questioning it.
as a social work scholar, I question the extent to which all of these therapists have all of this training. And I realize that out in the community, you are incentivized to be a generalist. People walk in the door and you figure out what works, right? It's
Yeah,
one of the things that makes being a mental health professional so challenging and so rewarding. But my point is that even if I'm looking at that list, I might see that somebody's been trained in DBT, but I know that individual outpatient therapists don't do DBT, right? They might use DBT skills,
right.
but you can't do DBT, dialectical behavior therapy, on your own, right?
Yeah,
That's not the model. And we also know that DBT may not be appropriate for your seventh grader, right?
right.
So there are lots of things. And so if you are a mental health professional and you have some expertise, please reach out to your school, your local high school, middle school. Say, hey, I'm a resource. And be honest. Like, say, these are the parameters of my work. These are my fees. I don't come to schools, or I do make school visits.
Hmm.
Blah blah blah. Like, talk to the mental health professional so they know what's up, and tell them what your training is. If you went to an assist training, great,
Yeah.
right? If you're trained in QPR, if you've done mental health first aid, if you've been hanging out on the SPSM chat, either version 1 or 2, right?
Two.
And so
Yeah.
you
Oh, yeah.
have, you have some sense of the field. Like, all of that is really
Yeah.
important.
And that's a really good point because, um, and I made a note of it. I jotted it down because I need to speak to. One of these schools has 600 students and
Hmm.
one adjustment counselor.
Oh my God.
Oh
Oh.
no, that's the smallest amount I've
Mm.
uncovered so far. With one, count them, one, maybe two. They have one that comes in and visits. But I remembered sitting in the office, and that was exactly who came through the door. A clinician came through the door and signed in, and everybody said hi. And she said, okay, well, where am I going? And she was not school staff. She was a consultant, and she was going in because they only have that one adjustment counselor. So from the family perspective, I can understand how frustrating that is to hear.
Hmm.
And so here's what I heard from two kids in that while I was standing there. Well, I don't want to bother her because I know she's the only one and she's got all the kids to talk to. And I went,
Yeah.
whoa,
Wow.
whoa. So one of the other topics, Jonathan, that
Yes.
I would like to touch on before all of a sudden we say it's time for final thoughts. Let's talk about dealing with schools and grief.
Okay.
Schools and grief, and particularly I am still on a seek and search mission. I love the Dougie Center. They are by far one of the best we've ever got. I love the material that comes out of Myrick. That they have one of the best for how to talk to a child after a suicide attempt. I love that piece of material. But my deepest concern when I start hearing everybody coming at me with ACEs
Mm-hmm.
for those out there, adverse childhood experiences.
Mm-hmm.
And we're thinking about that. Grief is one of those.
Mm.
And grief unaddressed, we know will come up and bite you in the ass somewhere down the line. It might be 10 years later, it might be 20 years later, but if we can't help kids communicate on how to talk about that in a healthy manner, that trauma stays.
Yeah.
So whatever you might want to throw in, and then now and then I don't want to lose track of. I really want to know what it is you wanted to talk about with technology. That
Sure.
that caught my ear when I said, "Oh,
Yeah.
okay, all right, let's talk about that." But the grief is I see because I'm dealing with schools who have been bereaved.
Mm-hmm.
I'm training a police department that has been bereaved.
Yeah.
And I certainly deal the third Thursday of every month with feet on the street peeps like me
Mm-hmm.
who are still bereaved.
Yeah.
We have a community touch. Just take the numbers and take Julie Searle's math. Take my 86, multiply that by 135,
Mm-hmm.
and sit and think about that, and only have 5 to 7 people at our kitchen table conversations at any given time.
Yeah.
Where are the other 12,000? And
Mm-hmm.
what are they doing? So grief is a big thing around here for me. Tag, you're it again.
um, I mean, there's so much to talk about with grief. I mean, if you look at just even the basic kind of long-standing, well-established research, we know that people go through the grief process differently, right? Everybody's process is different. You have some people whose experience of bereavement, the sadness and the guilt and the sort of kind of mental confusion and emotional dysregulation, like that, spikes really soon after the loss. And then you have folks for whom it it doesn't for
Mm-hmm.
weeks or maybe months, and then
Right.
it does really in an intense way. And um and for both of those groups, you have kind of the normal up and then down, but there are those for whom there is no down. And call it complicated grief or whatever you want to call it, right? These are folks for whom the kind of the normative experience of moving through grief and loss and back into a place of integration and finding joy and pleasure in life is something that is elusive. And when you think about a school,
Mm.
you have kids who have different experiences with grief and loss, who have different capacities for processing the grief and
Mm-hmm.
loss. You have
Mm-hmm.
teachers,
Mm.
many of whom are in this profession because they are passionate about children and kids,
Yes.
and seeing a student die for some of them completely shatters their understanding of the world. And when somebody's understanding of the world is shattered, we sort of colloquially refer to that as trauma. um, and so then you have this grief and loss reaction that is also a trauma, and you have the trauma responses, which can involve in a very real way, trying to avoid the thing that is traumatizing.
Mm-hmm.
Now, this is really hard if you have to walk into school every day and you have to see the hallways and you have to walk by the lockers, and you're in a middle school or high school, so you can't remove that student's desk. You can
Right.
reconfigure the room, and shift people around, but everybody knows, in some level. So there's a re-traumatization that can happen. And then if you have a second suicide in that same school year and everybody's already walking on eggshells, it can just be more than anybody is really set up to handle. And so this is one of the reasons why it's so important to have prevention, right? And I'm not trying to get away from the grief and loss stuff, but
Yeah,
I
no.
do want to just have on the record, like, you have to have your crisis team, right? You have to know who's going to come in the event of a death, right? Because it might be insufficient to have the people in the school. Now, it might be sufficient, right? Depends on what's going on in the school and the community. But, I've talked to a number of school districts, and, they have local hospice organizations that regularly do grief and loss, right? When I was in Texas, there was Camp Braveheart, which was a summer camp for kids who had experienced a significant loss, right? And, I'm not saying you should wait until Camp Braveheart and then send the kids off for a week. But what I'm saying is that thinking through what are the grief and loss supports in a community are important, because you do want to have the people who can come in right away and do everything from psychological debriefing to kind of a mental health first aid to, these grief and loss support groups in the school. You want to know that there are resources out in the community. And a lot of times I find that schools have thought through the mental health piece and said, well, we don't really have a lot of mental health supports. And then I say, well, what about the faith communities? And they say, what do you mean? I'm like, some people have said that religion came about as a way of understanding death. And all faith traditions have a way of ritualizing and making sense of death. Now, I'm not saying that school districts should have faith communities be their only source of support. But if you're not thinking of helping families be connected to safe faith communities, and when I say safe, I mean you do not want to send somebody to a faith community that is going to shame, or judge a family, or in some ways sort of threaten their sense of community as a result of the suicide death. And luckily, most faith traditions these days know better.
They do, and if I'll just interject,
please,
because what you're talking about, and I know Melissa Brown's on the chat, so she's going to love what I'm about to say. Okay. That what we're talking about is a public health approach. Yes. We're talking about population focused. We're talking about, and I think without realizing it, that has helped me in this work within suicide. Because I'm 35 years in public health. Yeah. It started with domestic violence. And then I was asked to do work with, at that time, it was called alcohol and drug addiction. It was not called substance abuse. But that's what happens when you're 35 years along with this. And then coming into suicide prevention, intervention, and postvention work 12 years ago, it was under the blanket of the Department of Public Health. So I was so conditioned to bring everybody, you're right, everybody to the table, including the faith-based community. They were one of the first groups that I started training when I started doing suicide prevention work. And they were really, for the most part, I need to say for the most part, I doubt that any of them are watching this, but there were a few who, unfortunately and sadly, are still entrenched in archaic thought process.
Yeah, that's
for the most part, it is very modernized. They are they've been very progressive. One of our best champions is a pastor in the next community. But I agree with you. Not that the schools should look to, they shouldn't look to any one group. It should be a completely holistic wrap around that school district. And there's your public health approach, to eliminate. And I keep using the cardiac issue of, both for to deal with the losing someone after all the work we've done. I said, look, some of the best conditioned people die by a heart attack.
Right.
That we can't pick and choose on that. So I'm glad you mentioned that, because the faith-based community is integral to our work, as is law enforcement, as is the behavioral health. There is no one who shouldn't be at the table. I'm one of those people who keep saying, no, we'll find another chair. Come in, sit down. Can we blow up the damn silos and just all come to the table?
Yep.
So there's my graphic for the night. Blow up the side. That's my favorite. You should have seen me a year or so ago, Jonathan. Tracy and I were doing keynotes down in Maryland, and it was the summit of intersections, intimate partner abuse, ACEs, and substance abuse. And they wanted us to come in from our two perspectives as a temp survivor and impacted family, and weave suicide around that. And I thought, we need to blow up the silos. And I've shared this on SPSM recently, more than once here. And then I put my fingers to the keyboard and said, and do you want Homeland Security at your door? If you are going to Google, how do I blow up a silo? Because you're looking for graphics. So speaking of that, then, if we want to shift from grief for a little bit, because it's already 20 minutes off.
Wow.
Tell me about your technology.
Yeah. Well, and I do want to give a shout out to a couple folks, right? Sure. I know that in terms of the faith community, Sherry Moloch in the DC area has done some pioneering work on developing youth suicide prevention programs for African American youth in churches.
No kidding.
African American churches, right? And talk about, starting where the person is, right? If you're wanting to tap into the sort of the heart and soul of a community, like, do the work there.
Yeah.
Don't say, okay, so how do we convince the school district to do this, or how do we make sure that people trust the mental health agency so they come to no, just do it in the churches, right? So Sherry Moloch has been doing that. In fact, Sherry and I had the honor and pleasure of talking with Steve Austin and Robert Vore on their Christianity and mental health podcast a couple years ago, the CXMH podcast. And now Holly Oxhandler she's a social work professor. She's co-hosting with Robert Vore. But I know Robert has been a longtime SPSM person. And so they've just been doing great work. And so, just sort of a shout out to them and their work in the faith community. Really, really important stuff. Now, in terms of technology.
Yes. I'm waiting.
Yes. So I think there are so many things that are really exciting in the world of suicide prevention and technology. One of the things is that there are a plethora of technology, apps that people can use in the spirit of kind of what you were saying about not necessarily suicide prevention or sort of framing it as suicide prevention, but really thinking in terms of wellness. Right. Yep. And I don't use the word wellness in kind of a generic hippy dippy way, but more thinking about, the things that we know that can help people build lives worth living, include things like emotion regulation, distress tolerance, feeling part of a community, feeling loved and valued. And for youth, especially, youth track what's going on in their social networks by being on social networks. Ira Glass had this great intro to This American Life several years ago where he was talking with a couple of 13-year-old girls as they were on Instagram. I mean, they were in the studio, and he was like,
Yeah.
"Oh, what is this?" and talk to me about this. And basically what he was saying is, when these girls post a photo, they are able to get information in real time about their social network based on the responses that they get.
Yep.
And so, and it's not just about people getting compliments like, "Oh, you're so beautiful, you're the best ever, I love you so much," which is kind of
Mm-hmm.
standard
Yep.
things that you might see on an Instagram feed. But they're looking for who is posting, how quickly did that person respond, who responded to that person, who did not respond, right? So they're doing this very sophisticated social network analysis in real time.
Yep.
It's the kind of thing that would have taken Anne Marie, that would have taken you and I weeks to figure out, but these kids are figuring it out in a matter of minutes. So thinking about technology and the role of technology in understanding the social network is really important. You have apps like, websites like Calm, right?
Right.
That
Yep.
you can use for mindfulness.
Yep.
There are sort of these social apps like TikTok, which used to be called Musically, where a lot of these viral challenges happen, and some viral challenges are really harmful, right? Cinnamon challenge, Tide Pod challenge, things like that.
Right.
But some of them are just fun. They're like, like the King Tut challenge, right? Or the mannequin challenge, or right, the things that, yeah.
No, we did a mannequin challenge. We
You
did run
did.
it. We run it as a PSA for suicide prevention. I'll have to send it to you.
Yes, exactly. So, and there are things that can sort of be community building, which I think we shouldn't underestimate the power of that. And so, if you have 100 million teenagers on TikTok, then I think it really pays for this suicide prevention community to think about, well, A, we should be on there, but B,
Right.
like, how are we going to be on there? And I'm not saying that we are going to create a viral challenge that is going
Mm-hmm.
to save lives, but we should know what is going on out there, and what
Agreed.
is making kids, even in the moment, feel like, oh, this is something that I want to live for, right? Um, but then you have more suicide specific apps. You have like My3, which is an app where you can identify 3 contacts, and it's sort of like
Okay.
their faces show up on the app, and you can press their faces and they get contacted. And it has a safety planning
Okay.
template that you can put your safety planning. There's an app called Not Okay, which, if you're not okay, you press the button and it sends out GPS information and a message saying, "Hey, I'm not okay, please contact me," right? To people that you've already established. And these can be really powerful, because if you're a school counselor, a school social worker, and you know that you can't be there after hours,
Yep.
and you might have done due diligence and said, "Hey, call, text crisis text line, or call the lifeline, or you know given a sort of a local number if that's what's going on." um uh you might also want to know that somebody has a specific support person that they can reach out to. And since they're already on their phones, being able to flip to the app and press a button and
Yeah.
know that there's, the signal, like the bat signal, has gone
Right.
out,
Right.
can be really powerful. Which gets me into a couple other things. My co-authors Terry Erbacher and Scott Pullen and I were revising Suicide in Schools, and we're going to be including a lot more information about diverse populations,
Mm-hmm.
the evidence that has come out over the last few years about First Nations communities,
Yep.
some of that through the Garrett Lee Smith, sexual and gender minority youth, communities of color, some of the work that Ariel Sheftal and colleagues at Nationwide Children's
Yep.
Hospital in Columbus have done around suicide risk and elementary aged youth. Right, and that sort of a major study found that African American boys
Yeah.
comprise the
So,
largest group of suicide deaths, and their
yeah.
diagnoses tended to be ADHD, right? Which
Hmm.
kind of opens up a whole new way of thinking about
Wow.
risk.
Yeah.
Um, and of course, just as a quick aside, I mean, developmentally, we know that ADHD and kind of the disruptive behavior disorders, ADHD not being a disruptive behavior disorder, it's a neurodevelopmental disorder, but ADHD and oppositional defiant disorder and those sort of
Right.
disorders, much more prevalent in elementary school. And then you have depression and anxiety and eating disorders and substance use and misuse. Those really ramp up in middle school and high school, which is why you get sort of more correlation between suicide risk in those groups. But before Sheftall's research, I don't think most people were talking about suicide risk and ADHD in
No.
elementary school kids. Like, it just
No.
wasn't something that was really on our radar. So it's really important. But I was going to say that one of the things that we're doing is we're continuing to refine the tools that we developed for the book, like the suicide risk monitoring tool, which is it's a piece of paper that a kid can fill out, or
Yep.
a school social worker, mental health professional can administer, and can be used over and over again to track changes in suicide risk.
Hmm.
And now we don't have an app that's coming out,
Yep.
but we have been talking with folks who are in the technology area about how might this be integrated in a more systematic way in
Hmm.
school districts. I've also had the honor and pleasure of talking with the folks at GoGuardian, which is a Google partner in education company.
Okay. Yep.
And they create software that runs in the background of Chromebooks to pick up risk. And so this could be anything from, kid is on their Chromebook at school and they look up
Yeah.
how to build a bomb, or blow up the silo, or how do I kill myself?
Right.
And the software flags this. Now, the first version was kind of very hammer and nail, right? Schools came up with a list of words, and then if those phrases or words popped up, then the administrator was contacted and things like this. In the last week or so, they've come up with a new piece of software, and I don't get paid for this also, just disclaimer, called Beacon, which is using machine learning to be much more proactive, and has an option for sending alerts to parents. So that,
Really.
yeah, so imagine a scenario where, well, so the current scenario is something happens in school, the school staff makes the contact,
Right.
then the school has to work with the kid, contact the parents, then there's this. Beacon will alert the school staff and alert the parents at the same time. And although there are some things that are a little concerning about that, right, for some parents, because
Hmm.
we know those parents who might react poorly if they find this out. I think for the most part, it is better to have parents know
Yeah.
when kids are saying things like, "Can Tylenol kill me?" Right?
Right.
They're typing that in,
Absolutely.
and so
Yeah.
they get the alert, and then it's not up to the schools to use their staff resources to be the only place that does outreach. Because honestly, like, they might get the alert, but they're dealing with somebody that's just been assaulted,
Right.
right?
Right.
Or somebody
Yeah.
else's parent was just deported,
Right.
and
Yeah.
they've got
Right.
600
Yeah.
kids on their caseload. And so this is really, I think this holds a lot of potential for the future of schools.
Yeah.
And then you have another app called Elevator, and this I am on the board of advisors for. Again, I don't get paid for it, but just full disclosure. And this is an app where people can join Elevator and get peer-to-peer support. It's not designed for youth. but it's not designed for youth, right? So
Right.
kids obviously can be on there. But this is the kind of place that I actually think holds a lot of potential and promise
Mm-hmm.
for parents whose kids are struggling with a
Mm-hmm.
suicidal crisis to be able to join the app, and they can create what's called support circles, where you invite people to be in your support circle. And so all of you can connect online in a secure, there's no advertisement,
Mm-hmm.
there's none of
Mm-hmm.
this sort of the Facebook is like selling my data to
Right.
marketers and they
Right.
might exploit there's none of that, right? It's a safe and closed environment where you can say, hey, I've got a 14-year-old who has been talking about killing herself for the last 3 weeks and I'm freaking out. And somebody else is like, hey, my daughter went through that last year. Do you want to talk? And you're like, yes, I would love to talk. And so you're chatting, it's anonymous, you can do video call. Um, and what this does is it speaks to the need to build community, support community um, in you can think of it as a public health way, or you can just think of it as a community way
Oh no,
where
I know how I can think about it. And I'm going to interrupt because we're almost running out of time.
okay,
Do you know what you just described?
uh, uh,
You just described impacted family.
yeah, well, there you go.
I'm
Just
sitting here going, wait a minute, Jonathan. I think
no,
that's
that's
a
exactly right. No, yeah.
no, and I think that is a great idea because I would never have expected that this is how we would end this tonight. But one of the one of the most important conversations we've been having about impacted family, and this is what happens at every one of the schools I've been at over the
Hmm.
last few weeks. The one question that gets asked over and over, Anne Marie, what do we have available for the parents? And
Right.
I say, well, as a matter of fact, we happen to have here in Bristol County
Mm.
a peer-to-peer self-care support for impacted family members. I said, and there is an online sample kit available. I said, but my point is, Jonathan, I can tell them that,
Mhm.
but there are millions of parents out there. So whatever else we can bring, no, it goes right back to one of the earliest comments tonight. This
Mhm.
isn't about one training does the
Right.
whole thing. It doesn't. There has to be the layers. There has to be the option for parents who could absolutely take love elevator.
Hmm.
Then there are the parents who are going to want, and I know Jackie Christmas is out there on there, and I know the families are going to say, hey, Marie, but we want face to face workshops. We can do that all the time. Don't worry about it. We're not going to stop doing face to face
Right.
workshops about this. But that's one of the conversations that Tony Wood and I had when we were talking about where do we go with impacted families. And
Yeah.
I very cavalierly said to him, I said, around the world and every option you can get. Because we have to
Yeah.
go to the people. We can't expect people to just come to us at a particular given time.
Hmm.
And at this point, we have 2 minutes. Jonathan, what are your final thoughts?
My final thoughts are first of all, I'm grateful that you invited me. This is such um, a it's a terrifying topic for those who haven't thought about it. It can be incredibly painful for those who are in the middle of it. Um, but I'm hopeful that anybody that's been a part of the chat tonight or is watching this on replay who is experiencing this or is thinking about this leaves with some sense of hope that
Mm,
there are things out there and that the work that we're doing it's about saving lives and more importantly it's about making sure that people have lives worth living.
and I have to say that I'm thrilled that you were able to come on. And I know it was an inconvenience for your family. So please, my thanks and gratitude. That's
Yes.
an important time of night that
Yes.
growing up, I didn't have that. And
Mm.
so I really did my best, not always well, but did my best with my kids as they were growing up. That was important. And I think that bedtime scenario and the storytelling is all about the social emotional learning that we're talking about that is so important for that the youngest of the youngest of the youngest. I am so grateful you came on tonight. I think I think we've given them plenty of food for thought for tonight. I can't wait to go back and look at the chat before I curate it and take a look at that. And then this video will be available. It is a tough conversation, but that was one of the things that I hoped would be able to achieve with rebooting SPSM, is to come from a very different perspective than what you guys did for 7 years, but bring in some pretty tough conversations that we have to have. My newest hashtag, and I'll close with this, hashtag normalize the convo.
Mm.
Jonathan Singer, thank you very much.
Anne-Marie, it's an honor and a pleasure. Thank you for having me.
Hey, everybody. You guys take care. Just a heads up, next week, Jess Stolman-Rainey is coming back, and she's going to be talking about some version of social justice. So you know that one's going to pop. So good night,
awesome.
everybody. Right.
Good night, y'all.
Good night.